Coumadin. Review for current users. Introduction. If you miss a Coumadin pill, should you add it to the dose of the next day? Select yes or no. Correct. If you miss a pill, do not take an extra pill unless less than 12 hours have passed since you missed the dose. Do not add it to the next day's dose. Do patients who are on Coumadin have to avoid certain vegetables? Select yes or no. Correct. When you take Coumadin, you can eat any vegetable you want, but it is important that you keep the amount and type of vegetables you eat regular. Changes in the amount of vegetables you eat can make your INR too high or too low. Patients who are on Coumadin cannot exercise 5 times a week. Select true or false. Correct. Patients on Coumadin can exercise as much as they wish. However, it is important to keep the frequency and level of exercise regular. For instance, if you regularly jog 5 times a week but then start jogging once every 2 weeks, your INR may vary and you will need a change in your dose of Coumadin. Can patients who are on Coumadin play any sport they want? Select yes or no. Correct. Because patients on Coumadin are more likely to have internal bleeding, they should not play contact sports such as football. Check with your healthcare provider before you start a new exercise program or sport. Green vegetables have a high level of vitamin K. Select true or false. Correct. Because having too much vitamin K in your system may lower your INR, it is important to keep the amount of vitamin K in your diet steady. The Coumadin pill should be taken at the same time each day. Select true or false. Correct. You should take Coumadin at the same time each day. If you are a few hours late or early, it is okay to take the pill. However, if you forget to take the pill for more than 12 hours, do not double the dose. Should patients taking Coumadin take over-the-counter medicine without first checking with their healthcare providers? Select yes or no. Correct. Other medicines can change how thin the blood is. You should check with your pharmacist and healthcare provider before taking any medicine, including over-the-counter medicine. Taking Coumadin while pregnant raises the risk of birth defects in the fetus. Select true or false. Correct. It can also cause excessive bleeding during delivery. If you are thinking about becoming pregnant, are pregnant, or want to breastfeed, talk to your healthcare provider about Coumadin therapy. Internal bleeding is more likely when the blood is thinner than it should be. Select true or false. Correct. Internal bleeding is more likely when the blood is too thin. If you see signs of internal bleeding, such as dark urine or stools, call your healthcare provider right away. Internal bleeding can still happen even if you follow the prescribed dose of your healthcare provider. Select true or false. Correct. Internal bleeding can happen even if you follow the prescribed dose. This is why it is important to tell your healthcare provider if you notice any signs of internal bleeding. Minor bruises are a normal side effect, and you do not need to call your healthcare provider. Select true or false. Correct. Minor bruises are normal and do not need a healthcare provider's attention. However, large areas of bruising or unusual bruising are not normal, and you should call your healthcare provider if they happen. Thank you for using Explain.